Jason Pickel, and I practice here in Overland Park, Kansas, where we primarily are geared towards treating chronic pain and chronic conditions. Now, today's video is going to be on low thyroid or hypothyroidism. And if you are suffering from hypothyroidism, most likely you've been to your doctor already or quite some time ago, or maybe you haven't had any treatment at all. But typical symptoms could be, your hair's falling out, or you're getting a large amount of weight gain, or constipation, gut motility, digestive problems. You just feel tired all the time, no energy, you can't think straight. Just a lot of these types of symptoms that may have brought you to your doctor. Most likely they've ran some tests, they look at your TSH and your T4 usually. Those are usually the only two tests that they'll look at. And based on that, if that TSH is high, it means it's trying to get your thyroid to make more T4. So you're given some thyroid hormone that brings that level up, and you start to feel a little better and you go on your way. Now, the patients that we mainly see are patients that, even though they've taken those thyroid hormones, they're still having all the symptoms. The symptoms aren't going away at all. And in fact, when they go back in, every time they go to their doctor, their thyroid level goes up and down, their TSH goes up and down. So their medication is changed, or the TSH looks fairly stable, they continue on the thyroid hormones, and they're given other medications for all the different symptoms that they're having. They're giving something for that constipation, they're giving them something for those digestive issues that just go on, and for the weight. They're told just to eat right and exercise. And can be very frustrating for these patients, because why, if those tests look normal, am I still having all of these symptoms? So what we have to do is take a step back and say, okay, let's find out what's causing your low thyroid symptoms. Now, if we look at all the research, we see that 80% of low thyroid, hypothyroid patients, the cause of their hypothyroidism is a disease called Hashimoto's disease. Now, I don't know if you've heard of Hashimoto's disease, but Hashimoto's disease is an autoimmune issue. Now, what does autoimmune mean? It means that your immune system is attacking you. In particular, it means your immune system is attacking your thyroid gland. You actually have antibodies to your thyroid gland. And a lot of times this can be, there can be a genetic predisposition for this. The thing is this is causing your immune system to have problems. Now, we've got to look at factors on why is your immune system having problems. Is there something in the diet affecting it? Is there something externally that's affecting your immune system to cause that elevation of those antibodies? So we're not just going to look at TSH and T4. We're going to look at all your other thyroid hormones. Let's look at T3. Let's look at free T3, free T4, T3 uptake. Let's look at, see if you've got TPO antibodies. Let's see if any of those things are positive, and then we can figure out what is going on. First of all, do you have Hashimoto's disease? And if you do, what are we going to do about it? Well, the first thing we have to do is we've got to evaluate your immune system. We have to look at your T and B lymphocyte subsets. We've got to look at your cytokines. We have to establish if you have Th1 or Th2 dominance. Now, I know this doesn't mean a lot to you right now, but what we've got to do is evaluate that immune system and do things to squish down that immune system so it's not just munching away at your thyroid all day long and making you worse and worse and worse. And once we can figure that out and change that, that's when we get great results with patients and these great changes. So if you'd like more information on what we do with low thyroid symptoms, especially when the medications aren't working, then go off here to the side and request more of our information. Thank you and have a great day.